The Restaurant Association's Wendy says a harsher lockdown will be the final nail in the coffin for many businesses in the country. This after the National Coronavirus Command Council directed the Health Department to closely monitor the rising COVID-19 infections, hospitalizations, mortality and recovery rates, which are largely driven by the Omicron variant. She joins us for more now. Wendy, so we cannot, in terms of business, afford another lockdown, you believe?
Absolutely. You know, we've certainly seen how the industry was decimated last year at this time with the unannounced lockdown. And we've certainly shown over the last year every effort to show that the health and safety of every single patron and people that work within our industry have been put at the highest level. We've worked hard with government over the last year and we've shown them figures, we've shown them the results. And I think the change in conversation to one of being, you know, is it infections or is it hospitalizations, has certainly paid off well in keeping the industry alive over this festive season.
This in spite the high number of infections with the Omicron variant, which moves quite quickly.
What we certainly did is we changed the dialogue from being one of infections to hospitalizations. And, you know, we applaud Netcare for obviously putting out the statement of how many people are hospitalized at a time. And we'll continue to work closely with the private sector in the hospitalizations to bring that number close. And as we move swiftly into the December trade, which is imperative for us for some form of recovery, we plead obviously for people to follow the protocols and the health and safety aspects to do the necessary sanitization, temperature checking and contact tracing.
Outside of the obvious of, you know, not imposing harsh lockdowns, what else does the industry need to resuscitate?
I think as we've seen this last variant and the low admission rate, we need to continue to ensure that the healthcare system is adequately prepared. We need to continue to put pressure on government to ensure that that healthcare system is prepared. And we're now looking at lifting the curfew. We certainly don't believe that there's a necessity for curfew, and there's also been no evidence that shows that curfew is problematic in the transmission of COVID.
Wendy, thank you very much for your time this afternoon. Restaurants Association, she's from the organization.